First, here's some background information to start with. Okay, according to WHO, antibiotic resistance is one of the biggest threats to global health today. In the European Union, drug resistance bacteria are estimated to cause 25,000 deaths every year. In a statement, the Director General said resistance to antibiotics could bring an end to modern medicine as we know it. The world urgently needs to change the way we prescribe and use antibiotics. South Korea currently has an unusually high usage of antibiotics. In 2014, 31.7 Koreans per every 1,000 were being prescribed antibiotics daily, which is significantly higher than the average for OECD nations, which was 23.7 per every 1,000 individuals. Especially younger than 6 years old age group showed the highest level of usage. As a result, there is a problem of reduced drug efficacy, which leads to using more and stronger antibiotics. Ultimately, antibiotic resistance leads to more medical expenditure, prolonged hospital stays, and increased mortality. In late 1990s, national health insurance went under dramatic price cut of antibiotics to reduce overall pharmaceutical expenditures. This had increased the demand since the drugs suddenly became more affordable. As a result, patients' demand sharply increased due to cheaper antibiotics available and also due to very low out-of-pocket costs. They started to overuse antibiotics without properly understanding its usage. This lack of proper education and awareness has distorted consumption patterns, having resulted in exposed moral hazard. For example, in 2002, 73.3% of Koreans were wrongly prescribed to take antibiotics for flu or cold at least once. The prescription rate was significantly reduced to 44% in 2014, but the figure is still alarmingly high. The popular belief among Koreans is that antibiotics fight infections caused by viruses such as colds, flu, most sore throats, and many sinus and ear infections. However, according to the WHO, symptom relief might be the best treatment option for such conditions. Unfortunately, a government survey found that more than 50% of Koreans were misinformed, still thinking antibiotics can treat colds and flu. Because viral and bacterial infections are often clinically indistinguishable, physicians, due to this diagnostic uncertainty, tend to overprescribe antibiotics just to make their patients happy. Since their payment fundamentally based on fee-for-service, it drives physicians to maximize their profits by prescribing it as much as possible. More importantly, the conservative and dogmatic nature of medical profession in Korea further distorts their economic activities. Here are some data from Health Insurance Review and Assessment Service. As you can see, the percentage of total antibiotic consumption has increased gradually, except for 2011. And also, infants and young children group showed significantly higher consumption rate. One of the possible intervention measures to correct this anomaly could be governments initiating innovative antibacterial drug developments for future resistance. Also, utilizing information technology such as IoT devices and health tracking software to accurately monitor and guide antibiotic treatments can be an option. Lastly, developing antibacterial storage programs to educate the public and reduce antibiotic consumption is the key.